8 common diabetes signs in women. Ladies, are you ignoring these strange symptoms that could be early signs of diabetes? What if that constant fatigue or those recurring infections aren't just part of everyday life, but actually your body waving a red flag? Diabetes doesn't always shout. In women, it whispers through subtle, surprising signs that are easy to miss until it's too late. In this video, we're diving into 8 often overlooked symptoms that affect women differently and how spotting them early could change everything. Some of these will shock you, others might sound familiar. Either way, knowing them might just save your life. Let's get into it. Symptom number 8, unusual fatigue that won't go away. Feeling drained after a long day is normal. But what if you're waking up tired, going through the day in a fog, and crashing hard without doing anything strenuous? This isn't ordinary tiredness. It's a deep, lingering exhaustion that no nap or cup of coffee can fix. For many women, this kind of fatigue is one of the earliest and most overlooked signs of diabetes. Here's why. When your blood sugar levels are too high or swinging wildly, your cells aren't getting the energy they need, even if you're eating enough. That energy disconnect leaves you feeling worn out, mentally foggy, and physically weak. This is especially tricky for women because we tend to blame this feeling on stress, hormones, work, or just doing too much. And while those can be factors, persistent fatigue that doesn't improve with rest is a red flag, especially if it's paired with other symptoms like frequent urination, increased thirst, or changes in weight. Insulin resistance, the root cause of type 2 diabetes, also contributes to fatigue. It makes your body work overtime to manage glucose, which puts stress on your system. Over time, that stress builds, draining your energy reserves day after day. If you're constantly running on empty despite getting enough sleep and eating regularly, don't just push through it. Pay attention. This kind of exhaustion might be your body's quiet way of saying, hey, something's wrong. Symptom number 7, frequent UTIs or yeast infections. Let's talk about something that many women silently deal with, urinary tract infections or yeast infections that just keep coming back. You treat it, it goes away, and then boom, it's back again. Sound familiar? Here's the hidden truth. Recurring UTIs or yeast infections might not just be a hygiene or hormonal issue. They could actually be your body waving a red flag about diabetes. When blood sugar levels are high, it creates the perfect environment for bacteria and yeast to thrive, especially in warm, moist areas like the urinary and vaginal tract. Think of it this way. Excess sugar in your bloodstream doesn't stay there. It can spill over into your urine, basically turning your body into a buffet for bacteria and fungi. That's why infections become more frequent, more intense, and harder to get rid of. This is especially important for women because we're more prone to these kinds of infections anyway. And when diabetes is added to the mix, it turns into a never ending cycle. Many women treat the symptoms with over the counter meds or antibiotics, but never get to the real cause hiding underneath. So, if you've had more than 2 or 3 infections in the past few months, especially alongside symptoms like fatigue or increased thirst, don't brush it off. This isn't just bad luck, it could be something much more serious. Symptom number 6, increased hunger, even after eating. Have you ever finished a full meal, maybe even a big one, and still felt like you could eat more? Not just a little snack, but an intense, gnawing hunger that doesn't make sense? That's not just a craving. It could be your body's desperate cry for help. This kind of constant hunger, called polyphagia, is a sneaky but common early sign of diabetes. And here's the kicker, it happens even when your stomach is full. Why? Because the sugar from the food you're eating isn't reaching your cells. When you have insulin resistance or your insulin levels are out of balance, your body struggles to move glucose from your bloodstream into your cells where it's needed for energy. So your brain gets the message, we're starving, even when there's plenty of sugar just floating around, unused. The result? You feel ravenous all the time. And it's not just annoying, it's dangerous. This kind of persistent hunger often leads to overeating, carb cravings, and rapid weight gain. Then the extra weight makes insulin resistance worse, and the cycle keeps spinning. If you're constantly hungry no matter what you eat or feel like you're never satisfied, it's time to pay attention, especially if it's paired with fatigue, frequent urination, or sudden weight changes. Symptom number 5, unexplained weight loss. At first glance, this might seem like a blessing. Losing weight without trying? Who wouldn't want that? But here's the truth. When it comes to diabetes, unexplained weight loss is a big red flag. And it's not the good kind of weight loss. It's your body sounding the alarm. When insulin isn't doing its job properly, your cells can't absorb glucose from the bloodstream. That means your body isn't getting the energy it needs from food. So instead, it starts breaking down muscle and fat for fuel. You're not losing inches, you're losing strength. Muscle, vital mass your body needs. And the scary part, you might not even realize it at first. Clothes get looser, the number on the scale drops. But underneath that surface victory, something dangerous is brewing. You may feel weak, fatigued, or just off. And by the time other symptoms appear, like extreme thirst or frequent urination, it's often much further along than it should be. Many women dismiss it. They chalk it up to stress, skipping meals, or a fast metabolism. But if you're dropping weight without changing your routine, especially if you're also feeling drained or run down, it's time to take it seriously. Unexplained weight loss isn't always a win. Sometimes it's a warning. Coming up, another symptom women often mistake for something else entirely. Don't miss it. Symptom number 4, irregular periods or PCOS. Getting worse. If your cycle's all over the place, one month it's missing, the next it's painfully heavy, it's time to stop blaming stress and start paying attention. Irregular periods could be more than a hormonal hiccup. For many women, they're one of the earliest signs of blood sugar imbalance. Here's what's happening. When your blood sugar is unstable, it messes with insulin levels. And insulin doesn't just affect energy, it also influences reproductive hormones like estrogen and progesterone. This hormonal chaos can throw your entire menstrual cycle off track. And if you have PCOS, that's an even bigger red flag. Polycystic ovary syndrome and type 2 diabetes are closely connected. In fact, insulin resistance is at the root of both conditions. So if your PCOS symptoms are suddenly flaring, more acne, increased facial hair, sudden weight gain, it may not just be PCOS acting up. It could be diabetes joining the mix. Many women live with unpredictable periods for years without realizing their blood sugar could be to blame. But missed periods, unusually heavy bleeding, or cycle-related mood swings are not just part of being a woman. They're a signal your body's struggling to maintain balance. If your cycle is consistently irregular or your PCOS symptoms seem to be spiraling, it's time to dig deeper. Don't just treat the symptoms, find the cause. And we're not done yet. Up next, a sign that shows up in the mirror, and it might shock you. Symptom number 3, dark patches on skin, neck, armpits. You glance in the mirror and notice a dark patch around your neck or under your arms. Maybe you scrub at it thinking it's just buildup or leftover makeup, but it doesn't budge. Here's the truth. This isn't dirt. It could be diabetes trying to speak through your skin. These velvety, slightly raised patches are called acanthosis nigricans, and they're one of the clearest skin signs of insulin resistance. When insulin levels are consistently high, it triggers skin cells to grow faster. The result? Thickened, darker areas that often show up in the folds of your body: neck, armpits, groin, even elbows or knuckles. Most women either ignore it or try to scrub it away. But this isn't about hygiene, it's about hormones. And while anyone can develop these patches, they're far more common in women who are pre-diabetic or already have type 2 diabetes. It's easy to overlook. It's not painful, it doesn't itch, but it's your body waving a huge red flag, one that says, hey, something's off with your insulin. If you've spotted these darkened patches and they won't fade, especially if they appeared suddenly, it's time to pay attention, because catching this symptom early could help you reverse insulin resistance before it progresses any further. Symptom number 2, mood swings and brain fog. Have you ever snapped at a loved one for no reason, or found yourself struggling to focus, even on tasks you usually breeze through? It's frustrating, and it could be more than just stress. If you're experiencing sudden mood swings, irritability, or a constant feeling of fogginess, your blood sugar might be to blame. Erratic blood sugar levels don't just mess with your body, they can wreak havoc on your mind too. When insulin isn't functioning properly, it impacts your brain's ability to regulate mood and mental clarity. This can lead to feeling anxious, stressed, or easily frustrated. You might also struggle with concentration, like your thoughts are stuck in a haze that you can't shake. It's easy to write off these mental shifts as just bad days or stress at work, but the reality is they might be pointing to something bigger. High or fluctuating blood sugar levels can cause the brain to feel out of sync, and the longer those sugar levels stay unbalanced, the more likely you are to experience chronic brain fog or even develop full blown mood disorders. Don't ignore these mental signs. When your brain isn't functioning at its best, it's a clear signal that your body is out of balance. And if you're noticing these symptoms frequently, it's time to take a closer look at your blood sugar levels and insulin health. Symptom number one: constant thirst and frequent urination. How many times have you found yourself constantly reaching for a glass of water, only to feel parched again in just a short time? Or maybe you're always running to the bathroom, feeling like you can't escape the urge to urinate. It might seem like a normal inconvenience, but when this happens frequently, it could be one of the first glaring signs that something is off with your blood sugar. Diabetes, especially in its early stages, often shows up through these very symptoms. When your blood sugar levels are too high, your kidneys work overtime to filter out the excess sugar, leading to an increased production of urine. As your body loses more fluids, it triggers dehydration, which makes you feel thirstier than usual. So you end up stuck in a cycle: frequent trips to the bathroom and even more water, yet never feeling satisfied. This isn't just a minor annoyance. It's a classic warning sign that should never be brushed off. If you're constantly thirsty, feeling the need to drink excessively, and can't seem to stay hydrated no matter how much water you drink, it's time to take action. Ignoring this symptom could mean letting diabetes take hold, but catching it early gives you the chance to make changes that can help manage or even reverse the condition. It's crucial to take these signs seriously. Your body is speaking to you. If this sounds familiar, it might be time to get your blood sugar checked. Don't wait until the situation gets worse. Conclusion: we've covered 8 crucial diabetes symptoms in women, some subtle, some not. If any sound familiar, it's time to get tested early. Early detection is key to managing diabetes and preventing complications. Share your experiences in the comments, and don't forget to like, subscribe, and turn on notifications for more essential health tips. Stay healthy.